We are going to get started. Hi, everyone, and welcome to a webinar by Eating Disorder Solutions. We're so happy to have you all join the conversation. I'm Noelle Carmen, your host, and today we are talking about eating disorders and myths that surround this topic. With us today are Nicole Hoffman. She is the Clinical Director for Eating Disorder Solutions. We are hoped to be joined by Emily Baum, lead registered dietitian nutritionist for EDS. So she will probably pop in at some point. Tiffany Godwin, the director of clinical nutrition at Connections Wellness Group. And last but certainly not least, Dr. Stephanie Waite. Am I saying that right?
Yep.
Okay, good. Therapist and ED specialist with Texoma Specialty Counseling and the Recovery Academy. Okay, thank you all for joining here and offering your expertise, and let's just jump right into the conversation. I wanted to start the conversation with the notion of not sick enough, this kind of myth around a loved one looking at someone they know struggling and saying, I see a problem, but it's not bad enough to actually seek help. So Nicole, can you just go ahead and start addressing why someone would think not sick enough when obviously there's a problem?
Yeah, absolutely. Well, apparently I've got two Nicoles right now too. So
hi, Emily. Yeah, if you could go ahead and just change your name while we're chatting, I think that would be helpful to the audience. And to me.
How do I do that?
3 buttons at the top right.
Yes.
But yes, so sick enough. I mean, that's definitely a concept that all of us in the eating disorder world, encounter. Many people sit there and say, well, I'm not X pounds. I'm not, I don't have bad labs. I don't have to gain weight. I don't do this. I don't do that. And so it's always something. But the reality is, like, an eating disorder is an eating disorder. So I know Stephanie, oh, sorry.
No. And does that come from like the general denial, lack of education around being able to identify what a problem is when you're mired actually in the problem? Tiffany, can you address that?
Yeah, I think it's a combination of things. I feel, well, especially so I'm surrounded by adolescents. And so especially with the kiddos, it's like they may not have any insight to what's going on. They know that doing these behaviors makes them feel better, whether it's restriction, purging, binging, and maybe it hasn't clicked that, wait, this might actually be something that is an issue. Or I don't want to stop this behavior. It makes me feel better, right? That's part of it too. And so where we run into this a lot is with parents and families. I think it's tough to hear that like your kiddo is dealing with something like this. And so I think initially it might be some of that denial, eating disorder, like, no way, that's not my kid, or this is a phase, right? It'll get better. So yeah, I think it's education, lack of education, and denial, both.
So I think you bring up, excuse me, go ahead, Dr. Wade.
I was going to add,
Emily.
Oh, you're good. I was going to add to that. And I think a lot of this, like hearing, oh, I'm not sick enough is, weight bias. So our society and medical community belief that eating disorders look a certain way, or if you, based on your body, determines like what type of eating disorder you may have. And so recognizing that weight bias plays a huge role in this belief that people aren't sick enough.
And
and our culture plays a role, right? How we like want to validate, or we encourage certain, I think, health behaviors that are actually really like disordered. There's just a lot of stigma around the disease, unfortunately, too. And so I think that's where we get this I'm not sick enough idea from, is we eating disorders, when you think of eating disorder people who aren't in the field who do this every day, a very particular image comes to mind because that's how we've portrayed eating disorders to look. And when we talk about eating disorders historically, we've presented these really complex clinical cases, and so people think that's that's what it takes to have an eating disorder. I also think this comes from also there is a symptom of having an eating disorder, and I'm going to butcher the name because it's like a really weird name, but there really is this thing. It is a disease, right? And so it really is a symptom. There is this thing that happens in the brain where, like Tiffany was saying, there is this like denial, but it really is this like belief of, no, I'm not sick. There's not a problem here. And so really it's hard for folks because their brain is telling them, no, you're not sick enough.
Right.
Are
And
you
a lot of
saying-
people have, with eating disorders, are thriving in their jobs or at school. And so I'm doing all these things, so I must not be sick. And if you even look at the diagnosis of atypical anorexia,
Yep.
that tells, like, if I'm a client and I'm like, oh, I have atypical anorexia, I'm going to think, oh, I'm not sick enough to have anorexia. So
Right.
there are still a lot of changes that need to be made there.
Mm-hmm.
Sorry, Noelle, I keep like,
No,
We're like,
no, it's
go away,
me.
Noelle, we got this.
No, I'm just going to be quiet. You guys can have the conversation. My apologies. I think just to get to what it is you're saying, are you saying that the inability to identify the problem is part of the eating
problem.
disorder itself?
Mhm.
And if so, what is the action item to move beyond that? If you're stuck in it, how do you unstuck yourself, either as a family member or as the individual struggling? Who wants to
These
take that?
conversations and education is a really great place, prevention, but I think I always go to food and our bodies and what we eat should never ever cause us any kind of like anything, right? So if you have any even kind of like funky feeling, emotion, thought issue when you eat or when you are with your body, I would say that's not the normal place to live, the healthy place to live, the best place for humans to live. So like that's when I would tell somebody, you probably need to go talk to somebody about that.
right, and just because it's normal or common to struggle with your body or food doesn't mean that it's healthy.
Right.
I don't know. I know hardly anyone who has no issue with eating. So what you're saying indicates that this is much more prevalent and normalized than perhaps it should be.
Absolutely. I mean, even look at the medical community. Like, why are we still basing things off of BMI? I'm not going to go on that soapbox. Let's not do that.
That's another talk.
That's like a whole nother hour. But if we look at, just what societal norms have been, that's what, everybody is saying, like, it's got to go this way. This is how it should be. This is how we should look. Let's look at, models. Let's look at this. And that's not reality. Like, that's not normal in the concept that you're not thriving.
Mm-hmm.
That's not a life.
Mm-hmm.
Yeah, and going back to the medical community, we really do have a weight-centric health system. And it's like, you do you, girl, like, love your body. Everyone's on that train. But when it comes to like, oh, I'm concerned about your health, right? Everyone's like, okay, but you're like, that still doesn't make me feel any better, and it's because we have that weight-centric, the big O word is a it has an ICD code.
Mm-hmm.
Like, that is wild that we're still doing that. So that's a big part of it.
Mm-hmm.
So let's jump into the idea of anorexia as the only eating disorder, the only serious eating disorder, and all the others are kind of there, but really, if you have anorexia, that's the serious one. Can you break that down for us just a little bit?
They're all serious.
Yeah.
They're all serious. I think it came from just, again, like how I think anorexia became maybe the media's like that
Mhm.
mainstream disease, because it is such no, all of them, every single, you know what it really is, all of these eating disorders are like a spectrum. Everybody
Yes.
moves through all these behaviors. I've never seen a client come in who's just had restrictive eating,
Mhm.
right? If there's restricting, there's binging, there's some kind of like, it all is just a big bag. What the medical world has wanted to do is create ways to like label and categorize these
Yes.
things so that we can say, here's how we're trying to like treat or address these issues. That's what it's about. But really, like, they're all the same
Mhm.
thing,
I love that
really.
you touched on that, because I always talk about, like, I don't give a crap about diagnosis. I
Right.
care about what are we working with? What can we do to target these problematic behaviors or thoughts or whatever. So unfortunately, like, we go back to the medical concept, like, let's get real. Insurance pays off of a diagnosis code.
Mhm.
That's reality, but nobody's going to be a cookie cutter experience with anything. And so, like, to go over to that whole anorexia is the worst or whatever media, when we look at how things are portrayed, like in
Mhm.
media and the news and this and that, it's the stereotypical like version of anorexia of like
Mhm.
emaciation. And so people are more able to see that. Whereas you could be walking down the street and 7 out of the 10 people, I mean, that's not a statistic, like, you have no idea, but they could look normal, but they could have a severe eating disorder. So on the outside,
Right.
things can present one way, but on the inside, we have no idea, and vice versa. And so that's where a lot of like the standard or the expectation with eating disorders, it looks like that stereotypical emaciated person. But in reality, that's a very small percentage in the grand
Mhm.
scheme of what eating disorders look like.
And let's like be honest, people like the shock value. If you said anorexia and showed someone emaciated, then well, I gotta learn more about this. But if someone is in a larger body and they're actively restricting, we society, not
Yeah.
we
Mhm.
or us,
Mhm.
assume they must be lying.
Right.
Yes.
Real.
Yes.
Mhm.
And so it all goes back to weight bias again.
Mhm.
And they're all very serious. They all create and have a huge emotional toll on our body, which also affects our physical body and well-being.
Mhm.
Yeah, and if we think about severity as far as like from a medical standpoint, the damage that purging does on so many systems, the erosion of the esophagus and the electrolyte imbalances and what it can do to your heart. And it's hard to talk to a 15-year-old about you're at a higher risk for esophageal cancer. They're like, okay.
Because they're invincible, right?
Yeah, they're like, what?
Invincible. But if we talk about severity, I mean, just making yourself throw up one time is not just making yourself throw up one time,
Mm-mm. And to kind of piggyback a little off that, when we look at the like perception, so even just in the eating disorder like community, it's more widely like accepted for anorexia as opposed to bulimia or binge eating. Oftentimes people feel like gross with the concept of purging, especially, or binging. There's a whole lot more shame involved with that. And so there's that myth of that concept that, well, I'm not sick enough. I'm not good enough if I'm fitting this, if I'm bulimic or I binge or whatever it may be. And so a standard is frequently looked at. I only really have an eating disorder if I fit the mold of anorexia, because that's more desired among people who have eating disorders, as well as like the society looks at that as more of an eating disorder.
And there really is this thing with eating disorders, like the competition that the disease causes in the brain. And again, this really kind of like belief that like, no, I'm not sick enough, right? People can really like be presented with information about how dangerous this is for them, and they just, it's hard to sometimes accept that information because we have this mold and the standard of what, no, this is what we've been told these things are supposed to look like, and I don't fit and match that, so it's not that. But again, like, I just go back to, we shouldn't suffer. Like, food should not be causing you any kind of suffering. Food is like the basic. You don't beat your, exactly. You don't beat yourself up when you go to the bathroom. Like, it should be that simple. And the fact that it's not speaks to our culture and the world that we live in, and why we have such, like, there's such a huge incidence of eating disorders because of our culture. I think it's 1 in 4 people are dieting, and then 25% of those are going to develop an eating disorder. So like, I mean, I'm not good at math, but that's a lot of freaking people. Like, that's bad. It's bad. It's bad.
I recently heard someone say something so horrific yet so normalized. Have you heard anyone say, man, I wish that I could just have anorexia for a little while to drop the weight? This idea of glorifying the weight loss part of it, and maybe is why we struggle with identifying or not sick enough. And I know we've kind of touched on that, but I've heard people say that before. So how do you even address that piece of it from the external view of things? If you're struggling and someone's like, oh my gosh, you're so lucky, you're just dropping weight, I wish I could do that.
Just uneducated.
Yeah. And I think it's like educating people that it's not a choice. And no one chooses to have an eating disorder. And the amount of like turmoil and anguish that we see in our clients, no one would choose that. And so as a eating disorder dietitian, I hear that all the time. Like, oh, I need to go. I wish I had that problem. I have the opposite. And I'm thinking, no.
They're not any better off than you, I promise.
No.
They're miserable too. Yes.
And so this belief that eating disorders are like a choice or vanity is just needs to be talked about more, that people need to be educated.
I want to piggyback on that because I think we need to be talking more about eating disorders. That's how more people are going to get help, really, because again, of the stigma and our weight centric society that we live in. It's letting people know, like, hey, we've been taught things, right? And eating disorders are not just about weight and food. They're really not. That's also very common myth or thought about eating disorders. So people are thinking, but I'm eating, or I'm doing all of these things with food, I must not have an eating disorder, right? But it really is it is a psychological disorder that affects us mentally, emotionally, and physically. And we can just talk about behaviors, but like you said, it's the tip of the iceberg. It's a lot deeper than that.
And even in so from the dietitian world, I mean, there was a study that came out that the incidence of eating disorders or disordered eating in people who are pursuing, becoming a registered dietitian, it's astronomical. And we do not get even nearly enough education about eating disorders as a dietitian. And I think
therapist.
I was gonna say, we're not any better on our end.
Yeah, it's crazy. But I think it's, it goes hand in hand, I could talk, even as there's still shame around, like, for you as a clinician, if you've struggled, right? There's still that shame there too. And it is hard. I mean, we're all human, right? It is hard to be like, yeah, that's me. But it's, within the dietitian world, it's a big problem.
Yeah. And that makes sense too, that people with eating disorders would want to go into the field of dietetics, right? The Minnesota starvation study proved that people who are malnourished, they become obsessed with food and want to learn more about it. I mean, a lot of our clients, I don't have to sit here and do nutrition education because they know everything about food,
Yeah,
right?
Right.
So it's like
It's funny.
our primal instinct is to go towards food because I'm hungry.
Yep.
Um,
Ugh. Yes, and food, we pathologize eating. It's just a normal human behavior. And here we are pathologizing things that people just use to like take care of themselves, right? And so that's another problem with the stigma with this is we want to pathologize weight, we want to pathologize human behaviors. And I think we address it by helping people kind of like deconstruct the like you're allowed to feel. How do you feel? How do you take care of yourself? How do you like show up in the world? Because it's all really an eating disorder is, I think, is a coping skill for dealing with hard, bad stuff. So you're allowed to deal. Let's just find different ways to do it.
Absolutely. I have to talk about that. Whenever somebody has like a slip or, whatever, I can't remember who it was. We were talking about, I don't know, just like the image of everything. When we look at the concept of substance use versus eating disorder, God, I can't remember exactly. I think it was Stephanie talking about just that concept. There's so much more discussion and openness actually around substance use. Think about like AA. They're taught, you speak your story, you get it out there, you talk about your recovery, but there's just some different type of stigma with eating disorders where those who are in recovery struggle to be open with that, especially in the clinician world. Like if we really want to spend like 8 days talking about that, I'm just kidding. We could, because, the reality is like most people who became therapists and dietitians and psychiatrists, et cetera, have been touched by mental health or an eating disorder or substance or whatever. And so like, we're human, we have our own stories, but there's such a negative stigma about that we put ourselves on this pedestal where we're untouchable, but that's not reality.
Right.
I find it interesting that you're comparing substance use and the way that you manage, the way that you heal with eating disorders. And that kind of speaks to our next myth about someone thinking my loved one isn't ready to recover. So I'm in this hopeless space. They can't recover until they're ready. And that notion of a rock bottom. So what does that look like in the eating disorder world? Is there a rock bottom, or is it a very different animal altogether?
I think most of the time when people come to treatment, they're not, I'm ready to give up this eating disorder, ready to move on. And just because someone's in that place doesn't mean that they can't recover. People often go kind of back and forth, like dipping their toes in the water. Like, okay, maybe I can try this thing called recovery, and that was really difficult. So I'm gonna go back to
Just kidding.
behaviors, right? Because the behaviors are their way of coping. And so I don't necessarily believe that, okay, well, when they get to a rock bottom, or that's fine, like they finally have an aha moment. I think a lot of those aha moments happen in treatment or in therapy or in sessions. Not right in that session, but like overall, yeah.
I think the big difference between substance use and eating disorders is we don't have to use substances 3 to 6 times a day to live. And that's what makes it so difficult, is because it would be like being in recovery from substance use and being presented with your drug of choice, 3 to 6 times
Every
a
day.
day. It would be awful. And so I think that's why when it comes to eating disorder treatment, if we wait till rock bottom, we're in deep water. Prevention is the best treatment. Talking about, when that just little inkling of disordered eating is
Mhm.
there, that's the time to take action, because it,
Yeah, I would say even before that. So like if we really look at the concept, I mean, let's not go on the dare concept of, you know, like don't do drugs, kids. But I mean, if we're teaching these kids younger of like, this is what this looks like. You know, there's often that misconception with like suicide. If you talk about suicide, it'll make people think about it, which in reality studies show like that's not accurate. The same kind of concept for this by educating youth about eating disorders and just like having a healthy relationship with your body and food, that's not going to create an eating disorder. It's not going to trigger, like that's not the reality. And so we need to really start like younger and younger. So having those conversations with our 5-year-olds when they're sitting there poking their belly and saying something about it, or they're saying, you know, a cookie can only be had once a week or something, that the reality is like food is food is food. And there's no bad food unless obviously like you're like allergic. Don't eat those. But you know, as long as you're not allergic, like food is food.
Right.
I mean,
Right.
if you ate an apple 17 times a day, that's not healthy, just like it wouldn't be, you know, okay to eat, you know, a cookie 17 times a day. It's all about like getting everything within the system.
Right. It's also hard to talk about, I think, and come and get help because our society is really bad about stigmatizing mental health in general. Like people are so not quick to go get help. They're waiting until they've hit some kind of crisis or rock bottom of, you know, oh my God, my kid just got rushed to the ER for suicide, or, you know, like that is when we can intervene, but we certainly don't have to intervene at that point. In fact, if we're intervening sooner, we may be able to prevent a rock bottom and a crisis. We may be able to keep you like in your life more and living. So I think we have to also be really talking about help exists, help is possible. And for any loved ones on, like I get asked all the time, Stephanie, what do we do for mental health symptoms? How do I help somebody? Go to therapy. It's not your job to fix somebody, to know how to fix somebody. Like go, like there's help. It's okay to get help.
Yeah.
And the earlier the intervention, the better the better the prognosis.
That goes back to the not sick enough.
Right.
Like, why would we wait until like on the spectrum you're over here as opposed to getting the help here to help prevent that ball from, you know, continuing to roll. And I wanted to piggyback off of like the stigma with even just seeking services. When we look at the myth of like eating disorders as like a white woman's disease, that's not true. But because of the stigma within, you know, the different communities and marginalized populations, many of them don't ever seek help, like for mental health in general, but then definitely not for like an eating disorder. And so if you look at like the Black community, oftentimes like mental health is never touched because there's such a severe stigma that they can't.
Let's talk about rules around food. We all have them, surely, or many. Talk about what that looks like. Is there any kind of normal rules people can and should have around food? What do strict rules look like? Like, give us the boots on the ground of, okay, this is a problem, or you should only be eating 6 times a day. 6 times, you know, healthy, clean food, or some people do the dieting where I've got 8 hours where I'm not eating and then I'm like going for it. Talk us through some of these rules and what they should or shouldn't look like, should they exist?
So I actually was talking with a group, I think it was last week, of my clients about calories. And I said, what do you think humans did before we knew calories and food? Like, because we're here, so we all must have, you know, survived. And they're all thinking, I'm like, you eat when you're hungry and you stop when you're full. So I say no food rules. I guess the only rule would be eat when you're hungry. And also that it's okay to also eat when you're not hungry. Like, when do we do that? If we're at celebrating a birthday or someone wants you to try something, like, that's also normal. So the more food rules we have, the more food rules that will continue going on that list. We never like make a list of food rules and then take them off, some off and add some back on. And it just gets to a point where you have so many rules, you don't know what to do. I'm not sure if you were asking for like, what are some specific food rules we see often? But if you think of every diet out there and you put all of those foods on the not allowed list, I mean, every single food would be there. And then the same for every food that's been said that is good, all of the foods would also be there. So it gets really confusing. And this belief that we have to eat only at certain times or not after 7, or we fast for this long. I mean, our body knows how to handle food. So we fast every night when we sleep. And so we need food all day throughout the day. And so really more education and breaking down this belief that everyone has to eat a certain way or a certain amount of calories. Every body is different. And so every body also uses the food we give it differently. So this belief that, you know, what, 2,000 calories for women and 2,500 for men, just across the board, it's crazy when you think about it.
Yeah, and I'll go on with the food stuff, because I could talk about this for 18 days too. There really is no blanketed food rules for any for like a group of people, right? We can't say like men need this, women need this. And honestly, even if you have this disease state, you need this. You know, when we think about the traditional role of a dietitian, you know, using nutrition to, you know, help people live with certain disease states or to prevent certain disease states or, you know, et cetera, et cetera, et cetera. Even, you know, I'm looking at the chats, you know, hormonal health changes the way our hunger and fullness signals, you know, make us feel. Same with eating disorders, right? If we have been ignoring our hunger and fullness signals for so long, they don't feel the same. They don't, sometimes they just stop. And so that's why, you know, when you're in eating disorder recovery, you need that structure around food for a little bit to kind of help your body normalize what it, you know, to get those systems to work again. And so I think there is a time and place for not rules, but guidelines and structure to help you get to a place where, oh, it's the coolest thing when you work with the kiddo and they're like, I actually felt hungry this morning. You know, it's a very cool thing that happens, and they can come back. You know, I'm not an expert in hormonal health at all, but I think, you know, the same concept can be applied there. You know, there is no good food. There is no bad food. You know, and there are disease states that change the way our body talks to us, but maybe we just need to learn whatever new language it's speaking after that disease state starts.
And all of these weight-related diseases are in fact stress-related diseases. So rather than talking about, well, you need to not eat this, but what can I add to my diet that would be, or when I say diet, I mean, what can I add to what I'm eating daily? What can I add that would really benefit my body? So rather than taking away, what can I also nourish it?
And it gets complicated. I see the chat here about like intuitive eating, right? Because we all do have rules around food. Like we are just born into this world, taught into this world. And unless you have, I'm going to say, a parent who's like in the eating disorder world, right? You're probably not getting taught anti-diet culture messages. So basically none of us know how to eat intuitively. And so that's often a big question. A lot of my clients are like, I don't know how to like not have these rules. Like, how do I start to feed myself? And I always go to values. That's what's driving my bus, are my values and the person that I want to be. So that's where I work with my clients, is your values, right? What's important to you? And that's going to change day to day, season to season. But I think our food and how we're like showing up to care for ourselves should just fit in with how we're living in alignment with our values, right? Values come first, and this all is just kind of how we like support our values. It's how I try to reword and try to help deconstruct these rules around food, because people are really looking for, how do I feed myself day to day, right? And so they need help kind of like I don't know, deconstructing these rules and coming up with maybe their own set of, how do I tune in to myself and tell myself when and how to eat.
And I'll often hear like, well, if I'm allowed to eat all foods, then I'm just going to go out of control and I'm going to eat everything. And that might happen, and it might happen for some time, that I'm eating everything. And that's a response from not feeding yourself enough. But eventually your body will start to catch up and you'll start, craving all different types of foods. Our bodies will tell us what we need. We just have to be in the place where we can listen.
Mm-hmm. It's like when you have that craving for whatever, and then oftentimes if it's something that's like bad that we've put that label on, and we don't eat it, we're going to keep craving it. That's how binging actually happens, is because if I restrict myself from eating sweets or carbs or whatever, then all of a sudden I'm just going to binge on it because my body's been needing something. So I actually just had a conversation with one of my clients 2 days ago or something. I was eating with her and, talking about that relationship with food. And I basically said, like sometimes, I'm wanting a salad. And then later on, I'm like, you know what? I want a salad again. And then sometimes I'm like, not it today, not happening. And so when we get to that spot where we can have the intuitive eating, it's listening to our body. Like sometimes I get on a kick and I want some of these things like pretty consistently. And then all of a sudden I'm like, I'm done. And I honor that. If I want a cookie, I'll eat a dang cookie.
Why don't we move into this next myth, which is this idea of you can only have one eating disorder. So my son has bulimia, and he's not going to develop any other, that's what he is. He is bulimic. And I think that speaks to something we touched on earlier that I want to get back to, is the spectrum, right? Mm-hmm. Getting back to understanding that there's a whole diverse set of behaviors. Just because you're diagnosed with one thing doesn't mean other things can't present themselves. Can we talk about that some? I think it's really important to the conversation.
Like Nicole said earlier, we have these diagnoses for billing, right? So it's what does it best fit into? Mm-hmm. But we really see people, might have aspects in multiple eating disorder diagnoses, or completely switch, go back and forth over time. So
pendulum.
Yeah.
Right, yeah.
It is. I explain the pendulum to clients all the time. I think what happens is it gets kind of stuck. All bulimia is, or binge eating disorder is a pattern of a certain type of a behavior, right? So it's just sort of saying like, this is your you do these types of behaviors more frequently, right? But it really is, I say, this pendulum that happens. And when people start treatment, it's got, like, when people start practicing intuitive eating and they've been restricting, or it's going to switch to the other side, and people get all freaked out because they start overeating. They get concerned that they're binge eating. How do we get balance, right? It has to be a little bit crazy and all over the place and go to the extremes to come to the center and kind of balance out. And again, we're trying not to pathologize normal human behavior. Humans eat. I will never shame a person for eating because it is what humans do. And so we cannot shame and pathologize normal human behavior. Are we creating patterns that are harmful for us, right? That's why eating disorders are so dangerous, because it's a pattern of very dangerous, like, behaviors that cause a lot of harm to people, mentally, emotionally, and physically.
Mm-hmm. Yeah, we with our team here at Connections, we try to do frequent CEUs, I guess, just listening to other people talk and continually learning. And we watched a CEU by Jessica Setnick a couple weeks ago, and she talks about this idea of right now, it's almost like when we started figuring out how to treat cancer, that's similar to where we are with eating disorders. Like, we know so little about eating disorders right now. We are treating the symptoms. We're treating the behavior, but we have to figure out what is the etiology, like where did this start? And she talks about 4 different categories. I think she calls them dysfunctional eating behaviors. And is it biological in origin? We're finding that people will have a concussion and develop an eating disorder. Is it trauma related? Is it more like addiction? Or is it like the social environmental, which is, when we think of eating disorder treatment now, it's really successful for the social environmental origin of eating disorders. But if we're doing talk therapy for someone who had a concussion and then developed a disorder, how effective is that going to be? So it's super interesting. I think we have a long way to go, and we're understanding more and more about it every day. But eating disorders are a spectrum for sure.
And that's it. We have a lot of learning to do. That's where a lot of the stigma comes from. Just, we have these like ideas of what my field has done a lot of harm, unfortunately, to like how we see sick people and mentally ill people. And we've really contributed to this belief of what it takes to have an eating disorder, and it's wrong. And we have to be spending more money on understanding this disease. It's so underfunded in research and education. They're just not, that's why like cancer is so where it's at now, because they've put a bunch of money in researching it, right? And so I think we're going to see, hopefully, the DSM change at some point. I think we're going to see, these things kind of, we're going to see these things that we're talking about included in the future, but we're not there yet. So glad we're having these conversations, and people hopefully will be taking these conversations forward, because that's how we start getting the medical community to get on board with this too.
Yeah.
What about this myth? Poor body image, dieting, losing weight as a teenager, that's normal. That is nothing to worry about. All teens worry about those things. It's part of, puberty and part of being self-conscious. Talk to us a little bit about that one.
That's part of the problem. Because it is so normal. That's the problem.
It is so normal.
Like during adolescence, most women gain about 30 pounds, and at the beginning of adolescence, and like your bodies are changing and it feels foreign. And then I'm also hearing these things about what my body should look like. And so maybe if I start dieting like I see everyone else doing, then I'll feel better about myself. but in reality, it's not normal. Yeah.
No,
think
dieting is the
they-
gateway drug.
I forget what the statistic is, but it's like 60 something percent. I don't know. Don't quote me on that. Of 5-year-old girls are already thinking about dieting and that they're fat at age 5. So it's, I mean, it's going back to when little tiny kids.
That's why I go, I mentioned about like education early.
Mhm.
These aren't things that are starting in teenage years. These things are starting so much younger, especially when we do look at like, puberty is happening earlier and earlier now. And so, call it, I don't know, 100 years ago, like say it was more so on like 15 years old or something. I'm not a scientist, I'm a therapist, please. And so like it looked a lot different, back then to where that change was happening, at 15 or whatever. And so the weight gain, the body change, the curves, all that kind of stuff. But now it's happening like 10, 11. And so when we see that, like they're still children, and they're going through such ridiculous changes. And I mean, that's not even discussed. So it's just like, oh, they should just deal with it and send them on their way or whatever. There's only education about a little portion. I mean, I just keep going back to that education.
Yeah, education and representation. This is why I think representation is so important. When I think about the media that our children are consuming, who are they seeing? Who is being centered? It's the same type of body. And so I'm really glad to see more. This is why what we do with clients is we'll kind of do like a social media detox, right? And kind of like clean out stuff. And are you following this person? Like it's like encourage people to follow people that like look like you, because it really helps our brain, right, to be seeing there are other bodies and there are other people that exist. Our brain develops a map. And so if we're just putting all of this information in our kids' brains of this is what bodies look like, they're gonna really be more inclined to want to diet. So what kind of media are we feeding children to, right, to help them develop that other bodies exist?
I was walking through Target. I'm sorry. I was just going to say, I was walking through Target the other day, looking at the models, and I'm starting to see different shaped models, more body positive, things happening in a very public way. Is it making a difference, or is it just calling attention to the problem that already exists?
Yeah, I wanted to touch on when we talk about education, there really needs to be a revamp of the nutrition education that's given in schools. I can't tell you how many kiddos I've talked to, and a question we always ask, when did your eating disorder start? Like, can you pinpoint when this really started? I can't tell you how many times it goes back to being weighed in front of their classmates, having some type of like weight related report card go home to their parents, having to run a mile and be graded on like how fit they are.
Do you remember the physical fitness test back in the 90s?
Oh, yes.
I was like, I'm gonna,
Yeah.
So that definitely, I mean, that is a huge thing that needs to be changed. And, nutrition education in classrooms sometimes is putting on a Netflix documentary. Like, I'm sorry, but you're just going to scare them more. I mean, you're going to make them more afraid of food. That doesn't address any of the body image issues. So yeah, revamping the nutrition education in schools it's a huge part of it.
And can we just tell people it's okay, like, to struggle? Like, it's okay that you don't like your body. It's okay that you feel uncomfortable. It's okay that you had a bad day. It's okay that you like sucked with food today. Like that's part of the problem too, is we have this belief that we're supposed to feel great and positive and happy and wonderful all the time. Like, that's great. And I want that for people, but that only exists on one end of this pendulum, right? We have to be normalizing, like, yeah, okay, you had a bad body image day. Who the F doesn't?
Mhm.
It doesn't mean anything about your worth or value as a person. You're still wonderful. If you don't love your body because you've had trauma and you have disease and illness and chronic pain, like, body positive is a wonderful message. But if you are not able bodied, that message may be sent and heard differently. Okay, but we're still like allowed to, again, feel as good as we can. And it's okay if we don't feel good. Like, it's okay. That has nothing to do with your worth or value.
And we've touched on this some, but walking into a doctor's office and the first thing your medical provider does is weigh you.
Step on the scale.
Yeah, that is your measure right there.
Exactly.
It's not just the school system, but also those are the messages we're receiving from the medical community as well.
And then still utilizing BMI and all this and this and this. And so I now have a physician, and I've had her for, several years, but she never cares about what the weight is. All it is like, okay, how are you feeling? Is there anything going on with your labs? Like, is anything going on? She's never made one comment, not one. And I'm like, why can't all providers be like you? Because the reality is, like, you can be overweight, whatever, and have no issues, nothing. There's nothing wrong, because once again, it's a made up concept, right? And you can be underweight and have severe issues. And so why are we basing everything around it? Like, honestly, there's no need to weigh.
Right, never, ever.
Our body weight, shape, and size is based on what we eat is just completely false. You can deny being weighed at a physician office. I've had clients who are in larger bodies that have tried to do so, and they would not allow her to be seen until then. And so there's still a lot of bias there. And so, the doctor might look at a weight, come in and say, this is what you need to do. But we don't even, how can you make that suggestion if you don't even ask me what I'm eating? I could not be eating at all. And then you're going to tell me to diet. And it's like, but I'm doing that. Right.
Yes.
So there's something intrinsically wrong with me. My body doesn't work. Yeah.
I think a little of that piggies over to, Noelle, what you were first asking about, like, walking into a Target and all that kind of stuff. I don't want to go off onto the deep end on this one, because it could be forever too, but the concept of like plus size, like,
Oh yeah.
Why? Like, it's clothing. And then we can sit there and we can talk about how you can take a size 10 from the same manufacturer, the same brand, the same whatever, and they're 3 different sizes technically. Or you can be, a 10 here and a 16 over here and a 3 over, like, what? So let's talk about how that mucks with everybody's thought process and like overall like health and wellness. Cause it's like, okay, well, I can walk in here and who knows what size I'm going to get. And there's still that belief, like, that my value is based off of the size or something like that. Or I can't get this cute clothing because it's going to be in plus size clothing. And that I can't purchase that because there's no way I should wear plus size clothing.
And don't forget, there's a whole segment of the store that's for plus size. This is the plus size. This plus size people only over here. I mean,
think about how stigmatizing that is, right?
Yes.
It's saying you have to shop over here and the other people have to shop over here. Like, it's very, it's still pathologizing. It's still sending this message that one is right and one is wrong or not okay or, whatever. And honestly, value is not found in your weight. It is not found in your clothing size. It is not found in where you get that outfit from Target. Like, that's really what people need to be hearing, is that's not, like, you could lose weight, but it's not going to do anything for you. You can wear the size. It has nothing to do with your worth and value.
Yeah, there you are still. And I like that. I mean, I like that it's slowly changing.
Yeah.
And that you're seeing plus size models who are actually like normal. So I like that we're going towards that direction.
Right.
But still, even then, there's this belief that if you are in a larger body, that body also has to look a certain way. It needs to be larger in the hips and butt and thighs and still flat on the stomach.
Has to be wear certain clothes. Yep.
Right. And so, and then people in larger bodies, there's still not enough places that carry their sizes. So, and then where you're like, what? I'm in the already the plus size section, and I can't find clothes that fit me.
Okay, last myth. I am aware of time. We have 5 minutes, but I don't want to leave the conversation without talking about this, because we are talking to a lot of clinicians here watching. When we're talking about therapy, and I'm a clinician, and I'm talking to my client, and I'm realizing this is an eating we're moving into an eating disorder conversation. Let me know as a clinician when it is time to either hand off a client to an ED specialist versus trying to deal in a topic that may need a more specialized conversation. Because I know there's a lot of conversation about, well, as long as they're in therapy, they're fine. But delineate that for us so that we understand better how to direct our clients.
Overall,
Sorry. From a dietitian standpoint, you know, when you get into that realm, and therapists, they always want to help their patients. Like, yes, I don't want anyone to, I don't think anyone's being malicious, right? But if a therapist who has no experience or exposure in working with patients who struggle with eating disorders, they can really do some harm. If you start talking about food, or you start giving them a, you know, well, have you tried this, or have you tried this? And so I think my answer would be ASAP, because again, especially if you value your relationship with your therapist, which a lot of people really do, and if they hear those things from their therapist, it's really hard to undo that.
Understanding our limitations. Like, I know I'm not the best fit for everybody. So knowing this is a little bit out of my realm, that's okay. And so reaching out for support there. As far as like a higher level of care, I would reach out if the client is suicidal, if they're not able to eat without supervision. Now my head's kind of spacing. If they're needing more support day to day and weekly sessions, you're not really seeing any changes, then I would reach out to a facility for a higher level of care.
On the therapy side, you know, Stephanie, I'm sure you've seen your share of people who've come to you after being like therapized by non-eating disorder clinicians. And, you know, exactly what Tiffany said is you can end up doing more harm than good, even though like the intentions are probably very like good. But the reality is like eating disorders in specific are like, it's one area that like you can't fake it till you make it. Like you have to have training and knowledge and all of that kind of stuff. It's not like, you know, you come out of school fresh and blah, 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 and then you get somebody who has anxiety. I'm not saying that anxiety is not a big deal, but that's a whole lot different than something that's like life-threatening. So eating disorders in specific, you have to be specialized training, all that kind of stuff. Now, if somebody has some disordered eating habits, then that's where you can just take a look at what's going on. Go ahead and refer them over to a dietitian, because I mean, that's outside of our scope of practice. Like we're not supposed to be doing any of that. And then that way they can have the nutritional standpoints. And then at that point, you can communicate like as a team concept and see like where are things currently at. But if you're not knowledgeable, it should be passed off.
And
It should, I agree. It's just not that easy. And that's
Yeah.
honestly one of the barriers and the issues to people being able to see a specialist, right? And so I always tell people, and I tell therapists, you're doing a really good job and you're trained in mental health issues. Why don't you get some supervision? Why don't you get some consultation? Please read a book. Please call up a specialist. Like there are, right? We want to be training more people on how to treat and address this issue. So that, yes, referral is like number one if you can do that, but that's not always available and an option. So do good work, just validate them, believe them, and don't talk about any food or body stuff until you can talk to a specialist and get some like supervision and consultation.
And I
Good
always
point.
say, if you're seeing a therapist for an eating disorder, you probably need a dietitian as well. And eating disorder dietitians are very different than other dietitians. So if you're looking for a dietitian online, and you see, I always look at like, what are their specialties? If one of them says eating disorders and the next one says weight loss, then they're probably not well-versed with eating disorders.
Right.
So also being aware of that there are people who specialize in eating disorders who are also dietitians.
Right. I know the time's a thing, but I do see a question about where to go for supervision or consultation. You can message me. I supervise. I'm a SEDS, and I will be a SEDS supervisor soon. So like, I would rather just know that people are doing good work. So I'm happy to talk with anybody about this more.
And you can look on the IADEP website too for supervisors.
That's the acronym.
IADEP.
Yep.
Yes. And just find your local eating disorder dietitian. Obviously, have to get a supervision to consult with.
Right.
I mean, they're hard to find, right? Even harder.
I realize that we've touched the tip of the iceberg with this conversation. I want to thank each and every one of you for your expertise, for taking time to share your knowledge with us. I want to thank everyone who watched. And on a side note, your CE information will be emailed to you. I hope that you all have a wonderful, wonderful day. Thank you so much. Appreciate you all.
Bye. Thank you guys.
Bye.
Bye.